What if I told you that something you do right before bed could be silently making your blood pressure worse every single night? Not what you eat, not how much you exercise, something most seniors never even think about. And here is the scary part. Over 70% of Americans over 60 have high blood pressure right now. Most of them have no idea that one simple bedtime habit could change everything. Stay until the end because what I am about to share with you could literally save your life or the life of someone you love. Welcome back to Senior Health Secrets Over 60. I am Dr. Jessica Reed. If you are new here, I am so glad you found this channel. This is a safe place for real health information made just for you. Hit that subscribe button right now and tap the bell so you never miss a video. Because today we are talking about something that every single person over 60 needs to hear. One bedtime habit that my patients have used to reverse dangerously high blood pressure, and it costs absolutely nothing. Let me ask you something personal. Have you ever woken up in the morning and felt like your heart was already working too hard? Maybe your doctor keeps telling you your numbers are too high. Maybe you are already on blood pressure medication and your numbers are still not where they should be. If that sounds familiar, you are not alone. The Centers for Disease Control reports that high blood pressure affects nearly 75% of adults over 65. That means if you are in a room with 4 of your friends, 3 of you have this problem. And here is what breaks my heart. Most people are told to take a pill and send home. Nobody is talking about what happens in those quiet hours before you fall asleep. Nobody is connecting your nighttime habits to your morning blood pressure numbers. But I am going to connect those dots for you today. I have been practicing medicine for over 15 years. I have worked with thousands of patients over 60. I have sat across from seniors who were scared, frustrated, and exhausted from fighting their blood pressure. And through years of working with real people, I started noticing patterns that no textbook ever taught me. Here is what most doctors will never tell you. Your body does its most important repair work at night, and what you do in the hour before sleep either helps that process or completely destroys it. Let us start with the first thing you need to understand. Your blood pressure does not turn off when you go to bed. Most people think once they lie down, their body is resting and their pressure naturally drops. And for healthy people, that is true. Doctors call it nocturnal dipping. Your blood pressure is supposed to dip about 10 to 20% while you sleep. But here is the shocking truth. Studies show that over 30% of seniors over 60 are what doctors call non-dippers. Their blood pressure does not drop at night. In some cases, it actually goes higher. And people who do not experience that nighttime dip have a dramatically higher risk of heart attack, stroke, and kidney damage. So the question is not just what your blood pressure is during the day. The question is what is happening while you sleep. And that leads us directly to the habit that is either protecting you or destroying you every single night. Now, here is the first point, and this one surprised even me when I first saw the research. The number one bedtime habit that reverses high blood pressure after 60 is slow breathing before sleep. I know that sounds too simple. Hear me out. When seniors over 60 practice slow, deliberate breathing for just 10 minutes before bed, their systolic blood pressure can drop by 10 to 15 points. That is as powerful as some medications. And here is why it works. Most of us over 60 are running on a stressed nervous system all day long. Your body is in a constant low-level state of fight or flight. Your stress hormones, called cortisol and adrenaline, are telling your blood vessels to stay tight and constricted. That keeps your pressure elevated. But when you practice slow breathing, you activate something called the parasympathetic nervous system. That is your rest and repair system. Your blood vessels begin to relax, your heart rate slows down, and your blood pressure drops naturally. I had a patient named Margaret. She was 68 years old. Her blood pressure was 158 over 94. She had been on medication for 3 years, and it was still not controlled. I asked her to try just 10 minutes of slow breathing every night before bed. 4 weeks later, she came back into my office. Her blood pressure was 138/82. She was in tears. She said nobody ever told her something this simple could work this well. And the best part is coming up next, because there is a specific breathing pattern that makes this even more powerful than just breathing slowly. The second point is about something most seniors do within 1 hour of bedtime that spikes their blood pressure without them ever realizing it: screen time. I am talking about your phone, your tablet, your television. Now, I know you love your evening shows. I am not here to take away your favorite program, but I need you to understand what those screens are doing inside your body while you watch. The blue light emitted from screens tells your brain that it is still daytime. It suppresses a hormone called melatonin, and melatonin is not just a sleep hormone. New research shows melatonin plays a direct role in regulating blood vessel function and keeping nighttime blood pressure in a healthy range. When you suppress melatonin with screen light, your blood pressure stays elevated longer into the night. One study found that seniors who used screens within 90 minutes of bedtime had significantly higher nighttime blood pressure than those who did not. I had a patient named Harold. He was 71. His doctor could not figure out why his medication was not working. His daytime numbers were okay, but his morning numbers were always dangerously high. I asked him one question: "What do you do the hour before bed?" He said he watches the news and scrolls his phone. We made one change: screens off 60 minutes before bed. 6 weeks later, his morning blood pressure was down 18 points. And what I am about to share next explains exactly why your body cannot heal while the television is on in the background. The third point is about temperature, and this one is overlooked almost completely. Your bedroom temperature has a direct impact on your blood pressure while you sleep. When your room is too warm, your body works harder to cool itself down. That extra effort keeps your heart rate elevated. It prevents the deep, slow sleep stages where blood pressure restoration actually happens. Research from major sleep institutes shows that the ideal bedroom temperature for adults over 60 is between 65 and 68 degrees Fahrenheit. That might feel a little cool at first, but that cooler environment signals your brain to slow everything down, including your cardiovascular system. I know some of you are thinking you hate being cold. Stay with me. You do not need to be cold. Use a warm blanket. Keep your body cozy, but let the room itself stay cool. One of my patients, a woman named Carol, 66 years old, kept her bedroom at 74 degrees because she always felt cold. Her blood pressure at night was persistently high. We dropped her room temperature to 67 and gave her an extra blanket. Within 3 weeks, her overnight numbers improved significantly. And there is something else about your sleeping environment that I need to tell you about right after the next point. The fourth point is about something millions of seniors take every single night without knowing it is wrecking their blood pressure: certain common over-the-counter medicines. I am talking about things like ibuprofen, naproxen, and some decongestants and antihistamines. These are medicines you can buy at any drugstore, no prescription needed. Many seniors take them right before bed for pain, allergies, or just to sleep better. But here is what they do inside your body overnight. These medications cause your kidneys to retain sodium. And when your kidneys hold on to sodium, your body holds on to fluid. That increases the volume of blood in your vessels, and that directly raises your blood pressure. The American Heart Association has warned specifically that nonsteroidal anti-inflammatory drugs, the ones I just mentioned, are one of the most under-recognized causes of resistant high blood pressure in older adults. If your blood pressure is not responding to medication, this could be a major reason why. Please do not stop any medication without talking to your own doctor first. But do have that conversation. Tell your doctor every single thing you take before bed, including the stuff from the drugstore. What comes next is something your doctor almost never asks you about, and it may be the most important factor of all. Before I continue, if this information is helping you, please take just 2 seconds and hit that like button right now. It costs you nothing, but it helps me reach more seniors who desperately need this information. And if you have a parent, a sibling, or a friend over 60 struggling with blood pressure, please share this video with them right now. You could be saving a life today. The fifth point is about sodium timing, not just how much salt you eat, but when you eat it. Most doctors tell you to reduce sodium. That is good advice. But very few doctors tell you that eating high sodium foods close to bedtime is far more damaging than the same food eaten earlier in the day. Here is why. When you eat salty foods late at night, your kidneys are already slowing down for their own overnight rest. They cannot process and excrete that sodium efficiently, so it stays in your system longer. It draws fluid into your bloodstream, and your pressure rises during the exact hours when it should be dropping. A study published in a major hypertension journal found that late evening sodium intake was strongly associated with higher nighttime blood pressure in people over 60. What counts as a high sodium bedtime food? Processed snacks, canned soups, crackers, deli meats, even some cereals. If you are eating any of these within 2 hours of sleep, your blood pressure is paying the price all night long. And what I am about to tell you in point 6 connects this directly to the one habit that ties everything together. The sixth point is about magnesium. And I want you to pay very close attention here because this is the one that my patients say changed everything for them. Magnesium is a mineral your body needs to relax blood vessel walls. It works almost like a natural calcium channel blocker, which is a type of blood pressure medication. When your magnesium levels are too low, your blood vessels stay more rigid and constricted. And the shocking truth is that over 70% of Americans over 60 are deficient in magnesium. Not slightly deficient, significantly deficient. And here is the bedtime connection. Magnesium works best in your body during the overnight hours. Taking a magnesium supplement about 30 to 60 minutes before bed can directly support nighttime blood pressure regulation while also improving your sleep quality. Multiple studies have now confirmed that magnesium supplementation lowers both systolic and diastolic blood pressure in adults. I had a patient named George. He was 73 years old, stubborn as can be. He had been resistant to making any changes, but his wife convinced him to try magnesium glycinate before bed. He called me 3 weeks later, almost speechless. His morning blood pressure had dropped 14 points. He said he also slept better than he had in years. Please talk to your own doctor before starting any supplement, but do ask the question. Now, let me bring all of this together for you because the real power is in combining these habits together. The seventh point is the one that ties everything into one bedtime routine, a consistent wind-down ritual that your nervous system can recognize every single night. Here is what science has shown us. Your nervous system loves predictability. When you do the same calming things in the same order every night, your body begins to anticipate sleep and relaxation earlier and earlier. Your blood pressure starts dropping before you even get into bed. Think about how powerful that is. Your body learning to self-regulate just from a consistent, gentle routine. The habits that work best together are dimming your lights about 90 minutes before sleep, turning off screens, doing 10 minutes of slow breathing, keeping your bedroom cool, avoiding salty snacks, and taking magnesium if your doctor approves. When my patients combine even 3 or 4 of these consistently, the results are remarkable. Not in 6 months, within 3 to 4 weeks. I have seen patients reduce their reliance on medication. I have seen morning blood pressure numbers drop by 20 points. And I have seen seniors tell me they feel more rested, more calm, and more in control of their health than they have in years. And the biggest part of that transformation is not any one habit. It is the decision to be consistent. Here is exactly what you need to do starting today. Number 1, set a screens off time every night 60 minutes before bed. Put a sticky note on your remote if you have to. Number 2, spend 10 minutes doing slow, deep breathing. Breathe in for 4 counts, hold for 4 counts, breathe out for 6 counts. Do this lying in bed or sitting in a comfortable chair. Number 3, Lower your bedroom temperature to between 65 and 68 degrees. Use extra blankets if you need to stay warm. Number 4. Review everything you take before bed with your doctor. Include all over-the-counter medications. Number 5. Stop eating salty snacks or processed foods at least 2 hours before you sleep. Number 6. Ask your doctor about magnesium glycinate. Show them the research if you have to. These 6 steps together form the most powerful natural blood pressure reset routine I have ever seen work consistently for seniors over 60. You do not have to do all 6 perfectly on day 1. Start with 2. Add another one next week. Build it slowly and it will stick. Let me quickly bring everything together for you. Your blood pressure at night matters just as much as your daytime numbers. Screen light before bed blocks melatonin and keeps your pressure elevated. A cool bedroom helps your cardiovascular system truly rest. Some over-the-counter medications silently drive your blood pressure up overnight. Late-night sodium stays in your system and spikes your nighttime pressure. Magnesium deficiency is rampant in seniors, and addressing it can help relax your blood vessels while you sleep. And a consistent, calming bedtime routine trains your nervous system to lower your blood pressure before you even close your eyes. I want you to know something. You are not powerless against this condition. Your body has an incredible ability to heal and regulate itself when you give it the right conditions. You are not too old to make changes that matter. I have seen it happen over and over again in my patients. Small, consistent changes at bedtime making a real measurable difference in heart health and longevity. Now I want to hear from you. Leave a comment below and tell me which of these habits you are going to try first tonight. Or tell me if you have already noticed that your bedtime habits affect your morning blood pressure numbers. Your comment might help another senior watching this video right now. If this video helped you, please give it a like and subscribe to the channel so you never miss a video made specifically for your health and well-being. And share this with someone you care about over 60 because this information is too important to keep to yourself. In the next video, I am going to share the single most dangerous medication combination that seniors over 60 are taking right now without knowing the risk. You will not want to miss that one. I am Dr. Jessica Reed, and I will see you in the next video. The information in this video is for educational purposes only and is not intended as medical advice. Always consult your doctor before making any changes to your health routine.